Hi everyone, this is Dr. Diane Hayden. I am the publisher of Elm Maine magazine and Natural Nutmeg magazine. And welcome to our Lunch and Learn live discussions that we're doing with our expert writers and contributors to help people cope with the COVID-19 situation, and also to just provide uplifting interviews about topics related to healthy living and how to lead a more holistic lifestyle, and also tips to integrate these things into your daily life. So I am excited to have with me today Dr. Jessica Peck-Lindsey. She's a doctor of acupuncture and integrative health and the owner of Peck's Family Acupuncture in Waterboro, Maine. Dr. Peck-Lindsey holds a Master's of Science in Pain Research, Education, and Policy from Tufts School of Medicine, and she's certified in Traumatic Stress Studies from the Trauma Center at Justice Resource Institute, with the aim of being able to better provide for patients living with pain and traumatic stress. Dr. Peck-Lindsey opened the Wellness Center at Peck's Family Acupuncture, integrating therapeutic movement, trauma-informed yoga, Reiki, emotion code, Tai Chi, Qigong, and wellness coaching, along with individualized acupuncture and massage therapy sessions. So thanks so much for being with us today. Dr. Jessica, how are you?
Oh, I'm doing well. Thank you so much for having me.
Awesome, awesome. So you have a fantastic article that's coming up in our May-June issue in Elm, Maine. And when I read it, I was like, wow. I mean, I've known about all the amazing benefits of acupuncture, but this kind of blew my mind in terms of some of the things that you were talking about with your case studies. So I'm like, this is going to be a great interview. I'm excited. So, just to back up a little bit, I feel like, and I know when I was first introduced to acupuncture, my first thought before I went for any treatments was, is this going to hurt? And I think a lot of people like see a needle and kind of freak out. And I have to say that, not only was it painless for me, it was completely relaxing and just one of the most amazing modalities that I've used in all my experiences with holistic medicine, for sure. So you start your article by saying, can it help, will it hurt, and how does it work? So why don't we just address those three questions, because I'm sure that's on the forefront of a lot of people's minds who are listening.
Yes. When I introduce people to acupuncture, I usually show them the needle. I don't have a needle with me right now, but the needles are very thin and they're filiform, which means they are not hollow, they are not syringes, but they are about the width of 3 human hairs. And so acupuncture needles inserted, and they're not inserted very deeply. They're inserted, if the needle is an inch long, it's only just a few millimeters that it's inserted in the skin. And quite often the needles actually flop over. So they're not inserted very deeply. And, but there is a sensation. Most people do feel a little pinprick. Most people, but there are parts of the body that are maybe more sensitive than others. So the ears are sensitive, the face is sensitive, but we're not putting needles in the face and the ears all the time. We're using the whole body. So there is a gentle pinprick sensation. Sometimes people don't even feel it. Can it help? So I do. I hope that acupuncture can help. Whenever anybody calls and says, listen, I'm considering acupuncture, or my doctor is saying that I should try acupuncture for this, I try to give them a very conservative prognosis. I can tell them the people that I've worked with who've had similar conditions, and then if I think that it's something that I don't have a lot of experience with, I might say, well, it reminds me that it might be similar to this. If I think that I'm unable to help them with acupuncture, I certainly know a lot of practitioners of complementary therapies that I can direct them to. But I think what prompted me to write this article is for the amount of people that I've worked with, acupuncture doesn't help everybody's issue, or it doesn't always address the main complaint. But then there's something interesting that happens, and acupuncture usually does address some other aspect of their life, whether it be say somebody comes in for irritable bowel syndrome, the pain, discomfort associated with it, we might find that, they still have the irritable bowel syndrome symptoms, but what they may find is that they're sleeping better at night, or they might feel more joy in their life. So that's a little bit what prompted me to talk about the article and to illustrate some of the cases that I've worked with. And the title of the article is Unexpected Benefits of Acupuncture.
Yeah, exactly. Well, I mean, I believe that illness or some kind of issue, starts in our energetic part of our body first before it manifests physically as something. And usually it manifests physically because we didn't pay attention to it, even though intuitively we know it's there. And I wanted to talk a little bit about, one of your cases, this man who had, all kinds of pain in his back, rib cage, jaw, had headaches. And as the weeks went by during his treatments with you, he was talking less about his body pain and more about his dissatisfaction with work. And this person actually went on to leave that position. And that was kind of like very eye-opening for me, because I read that and thought, oh my gosh, wow. Like, if he had never gone for acupuncture, would he have continued to, to me, the issue was his job. He was dissatisfaction or stress or unhappy or whatever it was. How long would he have continued to stay in that position and just continue to get sicker and sicker? And people don't make that connection that it's something potentially outside of the body that is causing the issue. And if you eliminate that, these symptoms may go away.
Mm-hmm. Yeah, I agree. It was eye-opening to me too, because this was early on in my practice, and having the background in pain research, education, and policy, I really wanted to figure out people's pain. I wanted to help people get beyond their pain. And so this gentleman had he had a lot going on, a lot of pain going on, and then one day he said, I'm leaving my work. So he was really about 10 years before retirement, but he just came to this realization that my job is making me sick. It's not helping my pain at all. Maybe it's even adding to my pain, and I'm ready to take the steps. And he gave his notice, and so within 2 weeks he was a retired person, which was just amazing. And I felt like, wow, did acupuncture have something to do with that? Did the acupuncture help him make the connection between pain and unhappiness? And also, did it help him help foster a plan of action? And so I explored this a little bit further and did some reading and realized, of course. So we have the organs. Each of the organs play a role in our bodies. They have an energetic role, and they have a functional role, but they also have a spiritual, mental, emotional role. And so this time of year is it's springtime. Buds are on the trees, grass is blooming. There's this upward energy, and it is the time of the year is liver. Liver is the yin organ. It's yang paired organ is the gallbladder. Liver does the planning. So in our sort of our spiritual life, liver helps us to plan. The gallbladder helps us to take that plan and make action. And so when there is a block of energy, when there's a blockage of energy, we are unable to see the future and to make plans for the future. And certainly, if we're unable to make plans for the future, when we're unable to make change and take action. So I think possibly what was going on with this man, and I would say, not everybody has a type, But if there was an organ that I would say that was predominant in his life and predominant in his physical complaints, it would have been the liver organ. And so what I think happened was through acupuncture, we kind of got the liver going. We opened up those channels to let the liver do the planning, and the gallbladder doing the taking action on that plan.
Right. Yeah, so let's talk a little bit about how acupuncture works, essentially. So just explain, you position the needles in certain places in the body for a reason. And then what exactly is that doing?
So a couple of things. One of the things, well, let's go back and talk about these places on the body. So if you were to see a model of a human body, you'll notice that there are lines, meridians, all along the body. Of course, we don't see it in real life, but we, the trained acupuncture practitioner and acupressure practitioners can sort of get a sense of, how these lines connect. And along the lines are wells of, or little, wells of energy. I guess we could call them wells of energy, just little, areas where the energy comes close to the surface. And then we insert the needles. And physiologically, what happens when we insert the needle is the body responds. The body says, "Hey, I'm being pricked by some foreign object." And so there is a histamine-like reaction. So the white blood cells become reactive, and they say, "Hey, what's going on?" And another thing that we know happens is when we insert the needles, the brain responds. So there's chemical reactions in the brain. So the brain releases endogenous endorphins. And so that's one of the reasons why when you have an acupuncture treatment, you start to feel relaxed, more relaxed. So beyond that, it's, and another theory, and I really like this. So we talk about fascia, fascia being the connective tissue. And, there is, Helen Langevin did a lot of research into, she would take, acupuncture needles and do, MRIs with corpses, with the tissues of dead bodies. And she would do things like twirl the needles. And what she noticed is that twirling the needle on a point on your wrist would have an effect on the heart. And so we know that point. The point right here is pericardium 6. We use this a lot for seasickness, but it also is, it has an effect on the heart protector, so our pericardium. So I think that's fascinating. By inserting a needle somewhere, there's this physiological response that happens somewhere else in the body.
Well, it makes sense. I mean, if you think about even as simple as just having an injury, if you get a cut or a scrape or something, I mean, we know that your brain, the only reason you feel pain is because your brain sends those signals. And so how is it doing that? It's got to be through energetic pathways, obviously. And then obviously stimulating all of the, the cells and things that the healing, practices that need to take place in your body because of that. So it totally makes sense to me that, with whether in my experience, I really didn't feel anything at all. It was almost like, it was like I felt like something was there, but it wasn't like a pinprick to me. And like you said, that might've been based on where it was placed on my body. But yeah, I mean, you feel a sensation on your body. Obviously things are going on so that to even have you feel that sensation. So that there's chemicals being released and energy being released and all of that going on, even though you can't see it.
Yeah. But not everyone understands this. And I think part of the confusion is that we piece out our bodies in Western medicine. We have the ear, nose, throat specialist. We have the cardiologist who specializes in the heart. We have the orthopedic surgeons who specialize in, musculoskeletal, conditions. And so we were conditioned to expect the body to be parts. And in acupuncture, we look at the body not only as a whole, but not as a whole body, but as a mental, emotional, spiritual being.
Right, exactly. And I think, while there is, good reason to have doctors that are specialists, I do agree with you that it does take away from the whole body approach. And, if we believe and understand that the body has the capability to heal itself, then we should be looking at it from a whole perspective, not just, oh, I have this one issue here, let me just isolate that. And, whatever we do here isn't going to have any effect on the body at all. Well, we know that not to be true because look at all the side effects and things that we have from drugs. And, when you try to isolate one thing or just sort of treat a symptom, it doesn't usually end up working too well.
Yeah, yeah. So I like to think of, medicine as, healing as more of a dialogue than really a lecture. And I think, that's why I think it's important that that people are aware of complementary therapies, that we are complementary therapies, because we work alongside with your primary care practitioners. And by working with a complementary therapist, I think it really gives people ownership of their health, because we can suggest, well, for your, low back pain, you might benefit from getting some exercise. Here's some Tai Chi, moves that I can show you.
Right, exactly. So I'm glad that you brought up that the organs are associated with not only emotions but also times of the year. So let's talk about that a little bit. What else should we be aware of? Is there anything that we can do, on our own in terms of whether it's spring or fall or summer or winter? And you can go through and talk a little bit about how each season is related to a particular organ, and then anything that you want to tell us as far as what we should be concerned about.
Yeah, sure. So I see things happening before the seasons. So I can feel in people's pulses before the seasons change. I might, feel a difference in their pulse, or I might notice that patients are starting to talk about common complaints, and it happens just a few weeks before the official change of the season. So for instance, we're now fully into spring, and it really feels like spring, but back in, I'd say February, when we're really not thinking much about spring here in Maine, that's when I start to notice things changing. So one of the common complaints in springtime is neck pain. I see it all times of the year, but for some reason, it's sort of, people will get a crick in their neck. And I think what happens, so we have a lot of wind in the springtime. It's a windy day here in Maine. And what wind is also considered a pathogenic factor in acupuncture. So we're really conscientious about not getting exposed to wind. So I didn't do this on purpose today, but I'm wearing a scarf around my neck. And that would be something that patients can do, is making sure you don't get wind on the back of your neck on a day like today. When people come in and they say, oh, I have this really stiff neck, it came on all of a sudden, I don't know why. One of the first questions I ask, I take account the time of year. So was it a nice warm sunny day, and did they open up their window at night, or do they have a ceiling fan in their room, or do they have a fan in their room to cool them off? Because you'd be surprised that when we go to sleep at night, a lot of times people like their rooms cool, but to have the constant cool air blowing on their neck when their body is relaxed is sometimes is not a good thing. And so the wind enters the neck, and then next day the patient has a stiff neck. And so we talk about how the wind has an effect on the body. And then in extreme cases, they might develop, Bell's palsy. And that's another thing I ask, what were you doing the day before? Was it a hot sunny day and then you went to bed and left the window open and the wind was blowing on your neck? So that in China, so Bell's palsy, if you are aware, the listeners are aware, is when one side of the face is almost like paralyzed, where the patient can't smile, they can't whistle, and that we call, in Chinese medicine, we call that wind stroke. And if you were to look at it from a Western medicine perspective, it looks very much like a stroke. Western medicine treats it with steroids, and I think they consider it like some sort of viral infection. In Chinese medicine, we call it wind stroke. So that's spring, that's wind. But getting back to the change of the seasons, I have some patients who like to be ahead of the seasons. And so I'll say to them, you know what, you don't have to come in, every month, just come in at the beginning of the season, just to make sure we get on top of, maybe your allergies or, whatever else is going on. Lung time of year, that would be fall. So the element is metal, and metal, interestingly, is sort of about organizing. So we think of school starting in the fall time and people being organized, and this is the time of year where people like to make lists and put things in categories. If it's and that could be a good thing. If it's disharmonious, it could be extreme. It could be like being, just too fastidious and having your schedule control you, or not letting go. So lung and large intestine is the yang aspect. Lung is the yin aspect. They are the paired organs. So this is another time of year when I see changes happening, big changes happening, where people might be more vulnerable to upper respiratory infections. And so that's a little bit, winter is kidney time of year. It's dormancy. The pulse starts to go into quietness, dormancy. And, it's what can I say about winter? I mean, we experience it here in Northern New England. We kind of want to just relax. We don't really want to plan or organize. We just want to kind of be quiet. And summer is the fire element. So we just want to get out there, and we want to experience just fun, and everything is bigger than normal. So I don't know how helpful this is to people out there, how they can really help embrace the seasons. But when you notice these changes, this is what's going on, because each season has its own element, and you might be feeling differently, and that's okay. Just have an awareness of, how you feel, and your body's telling you something.
Yeah, exactly. So I was just thinking, because I spend part of my time in Florida during the winter. And so I was just thinking, from an acupuncture perspective, does it make a difference? I mean, related to it being cold. I mean, we know that even in the southern states, it's more about the light changing. I mean, we definitely have less light than we do, and maybe that indicates, signals to the body, or indicates that it's more, it's time to kind of relax or go within during winter. But does it make a difference based on like the temperature of the weather?
That's a good question. So your body is acclimated to your environment. And, just like certain fruits and vegetables grow in certain parts of, the world, so too our bodies adapt and adjust. So even though we talk about, it's winter time of year, it's kidney, it's about, dormancy. If you're in a warm part of the world and it's not cold, you still might I've never, experienced a winter in Florida, but you're still affected by your environment. And, I would say that, kidney is the will. So, you're still being affected by your environment. And when we're in harmony with nature, we do, our bodies respond naturally.
Right, exactly. Yeah, I agree with that. I think it's, even though weather-wise it might be warmer, I think with light and things like that, you still kind of are in tune with the environment and, want to be making those changes. So it's interesting, you said, you talked about the liver and the gallbladder being about making plans and putting them to action. And you said that you have worked with people who have gone back to school in their 40s, put their homes on the market and moved across the country, changed relationship status, or even entered back into the workforce. So I just wanted to chat about that a little bit. I mean, it's similar to what we were saying before about the gentleman that you had with the pain and making his change in work. But it seems like you've seen some people make some pretty major changes.
Yeah, yeah, and and a lot of the times these people who are making major changes, they like the gentleman I was talking about, it may be they might have a lot going on, pain wise, and I think that's why they come to acupuncture. So it's not really an awareness that they're stuck in their life, but there's an awareness that the body's in pain. It might be fibromyalgia, it might be chronic headaches, and their pain doesn't, the people that I'm thinking of who've made these major life changes, their pain didn't really change a lot. They they had maybe better quality of life, but they were still dealing with this pain. But then I started to notice a trend where major changes were happening, and changes like, where did that come from? One woman was, she had her own business that she had been doing for 20 years, and then she decided to close her business down, go back to school, and now she's working for someone else. And it takes some strength, it takes courage to make those kind of changes. Another man, chronic headaches. He had a couple of traumatic brain injuries in the military, and so he had good reason for having bad headaches. And he, every week he'd come in and say, this acupuncture is not doing anything. This acupuncture, I'm not feeling any better. They've taken, the VA has taken away my pain meds because of the whole, fear of opioid misuse. He's like, I'm trying acupuncture. Well, he had lived in his house for, he had raised his family in his house, and he and his wife decided to move. And it was just kind of incredible. Just here he had been in this one place for years, and then they decided to move somewhere else. And I think that was a good change for him. He wanted to move to a warmer climate, which is not surprising for a lot of people. There's a lot, but for him to make that change in such a short amount of time was really astounding to me.
Yeah. Well, like you said, I think it's just, moving the energy, and blocks are lifted, and we're able to see things more clearly, or we're able to make, better decisions. I also want to say that a lot of times I think with holistic medicine, people who are just trying it, or, just choosing to do something from a more complementary standpoint, who are used to doing a lot of traditional, or they've used a lot of pharmaceuticals. I think people get into this mindset that things are supposed to happen like that. Like, I take a drug, my situation is fixed, or I go have surgery and it's fixed. And holistic medicine doesn't work that way. I mean, it didn't take you, 2 days to get your body into the situation that you're dealing with, whatever the chronic issue is. It's not going to take 2 days for you to get out of it. It's going to take a while. And I feel like, even though maybe people were coming to you and saying, well, I'm not really seeing, a quick result. I feel like and you may know this, but even if they didn't continue to see you, I feel like over time that pain probably went away, whether it was because of another life situation, and once they changed that life situation, maybe it didn't go away immediately, but over time it, it subsided. But again, the point I'm trying to make is that with holistic medicine, we can't expect that the change is going to happen instantaneously. It's something that takes time to get your body back to a healthier, more balanced state.
Yes, I agree. And I think we have this expectation of, you know, pain. Uh, we want pain to go away, and so we have this expectation that it can be removed. And really, what holistic medicine does is it shifts the balance. And you're exactly right about it. The development of the pain symptom didn't happen overnight. It's over time. And what it is, the way we look at it in Chinese medicine, each of the organs has a role to play. And so when one of the organs is not doing its job, the other organs have to step in and work harder. And so what that creates is an imbalance. And so trying to get things back into balance is not a one-step deal. It takes some time, because as things start to shift, the patient begins to notice other things. And for some people, it may be an awareness of a pain somewhere else in the body. It may be an exacerbation of pain. That can happen sometimes. As the organs shift and start to settle, and they start to, embrace their new role of, working more properly. So it really, and I'm glad you mentioned that it doesn't happen overnight.
Right. And a lot of times it's also, we have to look at a number of different areas. So you might be going to get acupuncture, but maybe you haven't cleaned up your diet. And so that can have an effect on whether or not how effective the other modalities that you're doing can be, for sure. So I think it's also taking that into consideration, looking at your lifestyle as a whole. What other things where do I need to make other healthier changes so that I can help, move this forward so I can get back to balance faster.
Yeah, exactly. I learned something years ago. I was a practitioner, and I was going to, get continuing education credits. And this is something that we didn't talk about in acupuncture school. In acupuncture school, acupuncture is the most important thing. I mean, that's why you spend 4 years in school. But really, in Taoist philosophy, there are 8 parts to health, and there are things that the patient is responsible for doing. And acupuncture is really the least important. What's more important is diet, exercise, your spiritual health, your happiness, all of these other things we need to pay attention to. And then acupuncture is really just sort of facilitating, your wellness so that you can do the other things better. So, but I think we get things mixed up because we're conditioned to put a lot of faith or a lot of belief into our medicine, whether it be Western medicine or complementary therapies. And really, there's a lot that we can do. We don't have to be dependent on other people making us better. Our bodies are really working hard to heal themselves.
Yeah, I mean, when you really sit down and think about what your body does on a day-to-day basis that you are not even aware of, it's amazing. I mean, and to think that it can do all these things. It can keep us breathing when we're asleep. It can, it keeps our heart pumping. It, keeps our metabolism working. It sends, chemicals and neurotransmitters and things to places that need attention. It does all this without our, conscious mind telling it what to do. It seems silly not to realize that Yeah, it's an amazing system. It's designed to be healthy. It's designed to be in balance, and it's designed to heal itself when you're out of balance. And these modalities, natural modalities, are things that you can use to help you, on this journey to get back into balance. But really, it's got to come from you on the inside, not something on the outside.
Yeah, that's well said. Yes, our bodies are amazing, and so it's important that we listen. We listen to our bodies because they can tell us, what they need.
Exactly, exactly. Well, this has been awesome. Thank you so much. And I'll say it again. I mean, I would encourage anybody listening to this to go try acupuncture. I absolutely loved it. And how do you want people to get a hold of you? Whether you want to have them go to your website, or any way that you want people to be able to contact you.
Yes. So the website is pecksfamilyacupuncture.com, and that's Peck, P-E-C-K, pecksfamilyacupuncture.com. You can send emails to info@pecksfamilyacupuncture.com. And we also respond to Facebook. So look us up, pecksfamilyacupuncture.com, and sometimes we have some helpful videos that you can watch and learn how to do wellness at home.
Awesome. That's great. And this video is recorded. It'll be up on our websites and also our social media pages too, at Natural Nutmeg Magazine and at Elm Maine Magazine. So check us out. And thank you again, Jessica, for being with us. This is a great call, and we're so happy to have you and all this information.
Oh, thank you, Diane.
Great. Everybody have a great day.